looks like we have let everyone in, so we'll get started. Welcome to our V3 implementation call. Today is May 22nd, 2024. And if you have not already, if you can go ahead and update your name also with your affiliation. We do take attendance for vendors as part of compliance, and it helps if we know who you're representing on the call, if you can add that. And a reminder as well, these meetings are recorded and they're shared on the NASEMSO website as well as our YouTube channel. So feel free to share with your team or others that you think may be interested in the topics, or if you need to go back and review a topic, they are available there. We do encourage your participation to prevent Zoom bombers. We have muted everyone as you come in, but if you have a question, if you can raise your hand or put a note in chat, and we're happy to unmute you if you would like to ask a question or participate in conversation. We encourage you to do that. And we're going to get started today. It looks like first thing on our agenda is the stakeholder introduction. And I'm going to do this. John couldn't join us today, so I'm going to share a slideshow he put together. Just one second here as I switch screens. All right, are you seeing the stakeholder introduction page now?
Yes.
Perfect. So the purpose of this is to get to know others on the call. So it's not just a name and face in a box, but that you know who it is you're working with, hopefully build some connections to lead to collaboration, get ideas for new hobbies as well. And we encourage you to be highlighted. If you haven't yet, I can put a note in the chat in a little bit with a link that you can fill out if you'd like to be introduced on the call as well. And we have a new person today. I don't think I have met him yet either. And when asked what he likes to do to relax or unwind, he said he likes to get outside, go hunting and fishing with the dog if possible. Some interesting facts about this person. His previous jobs included working at a diner and also painting barns and houses. And what does he like best about his job? He said it uses the uses it has for QI, funding justification, public health, programmatic decisions. He likes the data. Any guesses? Feel free to put a note in chat if you think you may know. This is a new state data manager. His name is Connor Dunn, and he is from Vermont, works for the Vermont Department of Health as their new state data manager. So it's nice to meet you, Connor. If you're on the call, feel free to unmute. Can we unmute him, Chris, if he wants to say hello? All right, maybe Connor's not on yet. All right, next on our agenda, I'm going to pass it over to Casey, who's going to go over some information on the SMART grant for us.
All right, good morning, everyone. Give me just a second to share my screen here. All right. So I'm kind of excited to bring this one to you guys. I've been waiting for this one to be released for funding when I read about it a couple months ago. So SMART Grant, Strengthening Mobility and Revolutionizing Transportation. Application deadline is Friday, July 12th, 2024 at 5 p.m. Eastern. Oops, 1 second here while I get my thing situated. There we go. All right, so overall purpose of the grant program is to improve transportation efficiency and safety through advanced smart city or community technologies and systems. So per usual for a lot of these NHTSA grants, it has to somehow have to do with transportation. As established in law, projects funded by the SMART grant program use advanced data technology and applications to provide significant benefits to a local area, state, region, or the United States. So benefits should align with the categories that are listed below here on the screen: safety and reliability, resiliency, equity and access, climate, partnerships, and integration. So program funding appropriation is about $100 million annually, starting from fiscal year 2022 through 2026. For this first stage, it'd be about $50 million available for fiscal year 2024. And you can get up to about $2 million per project with no matching requirement, which is really nice. Projects must demonstrate at least one technology area and may demonstrate more than one. A little infographic down there kind of shows the different things that they're looking for as far as the technology within the grant program. So who may apply? So a state can apply, political subdivision of a state, a federally recognized tribal government, public transit agency or authority, public toll authority, metropolitan planning organization, or a group of 2 or more eligible entities applying through a single lead applicant. So if you're partnering with somebody, you just have to have one person as that lead. And I know we always get a lot of questions of, can individual EMS agencies apply, things like that. So an individual agency would not be able to, but if they have a local authority that they can partner with, that's where that would come into play. So highly encourage that. This grant is really about building partnerships and getting grant funding to make your communities safer. So since the beginning of the grant, there's been about 93 projects that have been awarded, a total of $148 million across 39 states, territories, and DC since 2022. 2023 awardees include Henry County, Georgia. They received $125,000 to test CV2 crossing technologies for emergency vehicle preemption at intersections. We all know that's one of the most dangerous parts of our job in EMS is entering intersections during emergency responses. Maryland Department of Planning, they received about $1.7 million to deploy uncrewed aerial systems to provide medical package delivery to residents on the Eastern Shore and islands in the Chesapeake Bay. And then Southern Alleghenies Planning and Development Commission received just over $1.9 million for the use of uncrewed aerial systems to provide emergency response supplies in rural areas. So this is one of the reasons why I find this very exciting, because they're finding innovative ways to be able to deliver medical needs, emergency medical needs to some of our harder to reach areas. So you can get pretty creative with how we want to do that. I know one of the things that comes to mind for me is how we want to deliver blood products to scenes, right? Something to think about there. And remember too, when you're applying for these, for EMS, there's the guideline number 11 where EMS kind of falls on the NHTSA. If you read through that document, kind of gives you a guide of the wording and things you should use when you want to apply for these grants. There'll be an informational webinar on May 28th, 2024 at 12 p.m. Central Time. So the QR code here, if you scan that, it'll take you to the website to be able to register for that webinar. I'll give you guys just another few seconds here. All right, and then again, application deadline is July 12th at 5 p.m. Eastern Time. You can go to the URL at the bottom of the screen there. That'll get you to the application page and also get you more information regarding the grant, some of the specific details, those sort of things. And then as always, you can go to our grant page on our website, scan the QR code, it'll take you right to it. And you can always contact me if you want some more information. I am going to include some links in the chat before I am out of here, and it'll bring you to the official NOFO for this, as well as just some informational links to go with it. All
Great,
right.
thank you, Casey.
Hey, thanks,
And
Casey.
feel free
Casey, I got a question from an agency yesterday. If an agency partnered with their local regional authority, so a local TAC or something like that, would that qualify to be able to apply for this grant?
It should. It's
As
got to
long
be
as they're
some
authority?
yeah, it has to be some sort of public authority, transit authority, metropolitan planning authority, something along those lines. So that would qualify.
I gave them your contact info.
Perfect. Tell them to get a hold of me. We'll have a discussion.
Sounds good. Thank you, Casey. And if anyone on this call is interested, or if you know someone that may be interested in that, feel free to pass along this recording or Casey's information, and we're happy to help you get connected to more information. And next up on our agenda today is Jen Correa. She's going to talk about the updated extended data definitions created by NASEMSO, which have been posted recently on our website.
Yes. NASEMSO has put out the long-awaited extended data definitions update for May 2024 version, and it is on our website and available. It is under the technical resources, data dictionaries, and XSD, and scroll down just a little bit, and it's right here under the extended data definitions. And hopefully I have cache, otherwise I need to go incognito to show you. Didn't think about that, sorry. Yep, there it is, the May 2024 version. I will put a link into the chat for everyone so that you can get to it as well if you want to copy over that link. And I just want to say thank you. It's been a lot of hard work that NASEMSO put into it, talking about the different elements, how to put into educational terms that could be used to really kind of bolster documentation education. So thank you very, very much to all of the NASEMSO participants that worked on it. I happen to know the agencies use this quite a bit. If there are any questions or anything like that, please feel free to reach out to the TAC, or you can reach out to your state data manager as well. And that's about it for me today.
Sounds good. Thanks, Jen. And I do know those data definitions are used extensively. And if anyone has suggestions, that if they're happy to pass that off to the DMC as well, or work together with them to get some more made. If there's some that you think would be helpful or that you get questions on a lot, please let us know. Our next topic today is going to be covered by Clay Mann, and he's going to talk about some action items resulting from the NASEMSO conference last week, some takeaways of what we've committed to, and just kind of a follow-up for everyone.
Yeah, thank you, Lauri. And I'll just also state too, it was great to see so many faces in person at the NASEMSO meeting. And for those who couldn't make the trip, we'll just go over some of the action items that we from the NMSIS TAC are taking away from the great discussions that we had over 2 days there in Pittsburgh. I've broken down what we captured as the request into 3 categories. I'll go over those. If there are others that attended those meetings over those 2 days and they are not seeing something that they know we talked about, and there was some action that they'd like the NMSIS TAC or the DMC to take, please feel free to speak up. I'll go over them quickly because for those that were there, you heard these things, but I just want to make sure that we've captured everything that we should be doing to help your states moving forward with version 3.5 of NMSIS and NMSIS in general. The items that I think came out of the meeting that were directly related to the NMSIS TAC that we'll take responsibility for completing are these 3. Chad from Kansas and others talked about the need for us to develop additional use cases describing how EMS professionals, clinicians in the field should be using the new e-disposition codes. So we'll be extending the document that Ben put together with some of the work that Chad has done in Kansas. And if there are other states that have found this same issue to be a problem and have developed some use cases based on some feedback they've received from agencies in regards to unique situations, how do I code this? If you've developed products, if you'd pass those off to Casey here at the TAC, he's going to be taking responsibility for kind of extending that work that Ben did to include more use cases. We committed to doing a public training on the NMSIS schematron product and process. We We have done some good work on that in the past. This one will be more technical, so the folks can understand a little bit better how to actually write the schematron code. We committed to seeing if we could find an AI speaker for the annual meeting, and so we will be working on that. There were some action items, I think, just based on the good discussion, the DMC will continue to work on and will take responsibility for. We had great discussions regarding coming up with a nationwide master facility list. I think there's still some additional discussions the DMC wants to hold in regards to how we could reach consensus on that list. We spent a lot of time on this great new visualization that the DMC is coming out with. It looks at different EMS elapsed times in one large chart. There's some more work being done there. We talked about potentially adding a pertinent negative to the e-medications section that would allow us to indicate that we have left behind Narcan or naloxone. That discussion will probably continue. Just remind folks that there is a national custom element related to this topic that the DMC put together. So they'll continue to work on that in regards to recommendations. And if I've missed any, let me know. We talked about the extended data definitions document. There's this idea that the DMC asked if we could look and see if there are federal recommendations in regards to gender yet, and whether or not the NASEMSO TAC may be able to add the values and the discussions for those key elements that are in the extended data dictionary, if that could go in the electronic data dictionary that we provide on the website. So that is a request for us. And then we also talked a little bit about adding some custom values to ERS 12. Chad and some other folks talked about that as well. So I think there's some additional work to do there as well. We talked about a number of future projects that are coming up. I'll go through these just real quickly. Don't want to spend a lot of time on these, but we're continuing to work on the idea of coming up with a minimal data set for community paramedicine, mobile integrated health. The Data Governance Committee, a new committee within NASEMSO, met for the first time in Pittsburgh. We're excited about this in hopes that we can come up with nationwide ideas about how to extend our ability to use NEMSIS data. We talked about the NBC National Dashboard Project was underway. We mentioned two projects that will bring federal funds into states related to NEMSIS data, EMS data. One of those was ARPA-H. Happy to talk to anybody about that. And then the CDC is wanting to put together some pilot projects within states looking at how to get the NEMSIS UUID from the EMS record into the hospital record. NHTSA is funding a pre-hospital care research forum out of UCLA to concentrate on how we can look at data related to post-crash care, EMS data related to post-crash care. So that will help us with funding in the future. And then NAMSQA is developing some performance measures related to the care of a patient in a motor vehicle crash. We've made great progress in regards to violence against EMS providers within that arena. That work will continue. And then Lauri talked about a data quality initiative that will be kicking off very soon. So that's my summary. I'll just stop for a moment and see if there were any major topics that folks wanted the NEMSIS TAC to be kind of a part of that I missed in the review that was discussed at the DMC call meetings at NASEMSO in Pittsburgh. All right. Well, if any come to mind, feel free to reach out to me or anybody at the TAC, and we'd be happy to address those issues. Lauri.
Sounds good. Thanks, Clay. Next up on our agenda is any updates from the Office of EMS from NHTSA. I'm not sure if Eric or Jeremy are on the call, if you have anything to share today.
Hey, this is Jeremy. I'm not sure if Eric is here. I know he had a couple things come up this week, and so sounds like maybe he's not here, so I'm happy to give an update. First, happy EMS week to everyone. I'm down in DC I've been down in DC the past couple of days. We had a NHTSA Office of EMS Strategy meeting yesterday, which went really well. There are several EMS week events taking place in DC this week. So for folks, if you're in the DC, Maryland, Virginia area, there is an event this afternoon at the American History Museum focused on the history of EMS. So if you're around and you have time to make it to that, that would be great. And then I think there's another event tomorrow in the mall where they're going to be having some like stop the bleed events and CPR events, and they're going to have some like old ambulances on the National Mall. So again, if you're in the DMV and have time, please stop by. Just a couple of things from our office. And a lot of this came out of our strategy session yesterday, but there's kind of like three things that we've really kind of identified that I think are specific to the work that you all are doing, certainly at the NEMSIS TAC, among our vendors, our state partners. And this relates to a lot of the grant information that Casey did a great job of presenting earlier, but we're really going to be looking over this next year on how to improve the e-outcomes section. I know Josh has been doing a lot of great work in that space, and so just want to reiterate, his asks in the past, which have been, if you do have that e-outcomes data at your local level, please reach out to him and continue to work with him and seeing on how we can improve the e-outcomes data in both the state repositories and the national repository. We're working really hard with Clay on the UUID process. Jay in Wyoming have had a lot of great progress in that space, and we're continuing to kind of see how we might be able to see similar success kind of across the country, both for our trauma databases, but also, I think folks are probably aware that there is an electronic placeholder in MUC 6th edition for the NEMSIS UUID. So we've been brainstorming a lot about, how can we kind of move that NEMSIS UUID into the police crash report UUID. And then we've had a lot of discussions about automated crash notification and advanced automatic crash notification. So I think we're hopeful that we can continue to work with you all on those pieces. And if you have ideas or suggestions, challenges, successes in that space, please reach out to Clay and his team. Please reach out to Eric or myself. I think, there may be some opportunities to work on those issues and to utilize some of the grants that Casey talked about to make progress in those areas. Some of the other things that we talked about yesterday that folks may have an interest in, or we're doing some exploration on emergency medical dispatch, on identifying motor vehicle crash patients that are hemorrhaging, and we've been doing a lot of work on blood transfusion, ultrasound, traumatic brain injury, and also another topic that we're looking at is medical direction via telemedicine. So those are all things that I think we're thinking about that definitely have a direct relationship with NEMSIS and with the data that you all are collecting and utilizing. So if you have thoughts about those topics, please let us know. And then just one more thing I'll mention is, I think Casey and others at the TAC again have done a great job of kind of talking about all these grant opportunities. Gam here, the director of our Office of EMS, presented on those opportunities at NASEMSO. We've had a lot of webinars. So please let us know, or please let Casey and the folks at the TAC know what we can do to help you. We did, just as an example, there was a local EMS agency that reached out to us recently that was looking for some NHTSA FARS data that might help their application. So we were able to help them get some information on fatal crashes that were occurring within the counties where they respond. And also we were able to link them up with Ben at the NEMSIS TAC to help with some NEMSIS data. So if you need help with data, information, please let us know. And as always, if you have questions, concerns, if there's anything we can do for you, please don't hesitate to reach out to myself or Eric.
Great, thank you, Jeremy. Next on our agenda is just to announce our next training. We have a public training scheduled for June 11th, and the topic is correlation ID, and that will be presented by Jen Correa and Josh Legler. So mark your calendars if that's a topic you're interested in. And next, we'd like to open it up for open forum. If anyone has a topic or question, we'd love to take a few minutes for that. And Chris, if you can allow people to unmute during this time. All right, no questions today. Well, it's encouraging. It sounds like we all have a lot to do in the next year, some exciting work ahead, both by NASEMSO TAC and NHTSA and in your states as well. So lots going on. And our next meeting will be June 12th. And again, remember that these meetings are recorded if you wish to go back and rewatch or share anything. Thank you for your participation today. We know you all are busy and have a lot on your plate, and we appreciate you taking the time to be here. Thanks so much. Reach out if we can help in any way.